There are several body changes that you should never ignore and that may require your immediate attention. These changes could be indicative of underlying health issues or medical conditions. But before we move further, kindly like this video and subscribe to Wellness Wisdom for more informative videos. Number 11. Chest pain. Chest pain is a symptom that should never be ignored because it can indicate a range of serious medical conditions, including those that can be life-threatening. While not all chest pain is related to heart problems, it's crucial to err on the side of caution and seek medical attention if you experience chest pain, especially if it is severe or accompanied by other symptoms. Sudden or severe chest pain could be a sign of a heart attack or other cardiac issues. Seek immediate medical attention if you experience chest pain, especially if it radiates to your arm, neck, or jaw. If you have chest pain along with difficulty breathing, it could be a sign of a heart attack or a pulmonary issue like a blood clot in the lungs, pulmonary embolism. Seek immediate medical help. Chest pain that spreads to your left arm, jaw, neck, or upper back could be a symptom of a heart attack. If you experience chest pain following a traumatic injury, such as a car accident or a fall, it's crucial to get checked out to rule out any internal injuries, even if you don't immediately feel severe pain. Number 10. Shortness of breath. Shortness of breath, also known as dyspnea, can be a concerning symptom that should never be ignored. While occasional shortness of breath may be due to benign causes like strenuous exercise or anxiety, persistent or severe shortness of breath can be a sign of a serious medical condition. If you find it difficult to breathe or experience sudden, unexplained shortness of breath, it could be a sign of various respiratory or cardiovascular problems. If you wake up gasping for air or have recurrent episodes of interrupted breathing during sleep, it could be a sign of sleep apnea, a condition that requires diagnosis and treatment. If you experience shortness of breath after exposure to allergens, chemicals, or environmental factors, it could be indicative of allergies or asthma. Seek medical advice to manage these conditions. Number 9. Sudden and severe headache. A sudden and severe headache can be a sign of a serious medical condition, and it should not be ignored. While not every headache is a cause for alarm, certain types of headaches can indicate underlying health problems that require immediate attention. A severe headache, especially if it's sudden and unlike any headache you've experienced before, might indicate a medical emergency such as a stroke or migraine. If you experience an extremely intense headache that comes on suddenly and reaches its peak within a minute, often described as the worst headache of your life, this could be a sign of a life-threatening condition, such as a ruptured aneurysm or bleeding in the brain. Seek emergency medical care immediately. A headache accompanied by symptoms such as slurred speech, weakness or numbness on one side of the body, confusion, vision changes, or difficulty walking may indicate a stroke or another neurological emergency. Number 8. Unexplained weight loss or gain. Significant changes in your weight without a clear reason could be a sign of an underlying medical condition, such as thyroid issues, diabetes, or cancer. Sudden and significant weight loss can be a symptom of various medical conditions, such as hyperthyroidism, diabetes, cancer, gastrointestinal disorders like celiac disease or Crohn's disease, or infectious diseases like tuberculosis or HIV. Conditions such as depression, anxiety, and eating disorders can lead to unintentional weight loss. These disorders can affect appetite and eating habits. Conditions like hypothyroidism or polycystic ovary syndrome can cause unexplained weight gain due to changes in metabolism and hormone levels. Some medications, such as certain antidepressants, antipsychotics, and corticosteroids, can lead to weight gain as a side effect. Number 7. Changes in bowel habits. Persistent diarrhea, constipation, blood in your stool, or changes in the color and consistency of your bowel movements may be indicative of gastrointestinal problems or colon issues. Seeing blood in your stool, whether it's bright red or tarry black, should never be ignored. It could be a sign of various issues, ranging from hemorrhoids to colorectal cancer. If you're losing weight without trying, and it's accompanied by changes in bowel habits, this could be a concerning sign. Unintended weight loss can be associated with a wide range of health problems, including gastrointestinal issues. Noticeable changes in stool color, such as consistently pale or clay-colored stools, can indicate problems with your liver, gallbladder, or pancreas. Similarly, consistently very dark stools may indicate bleeding higher up in the digestive tract. Number 6. Skin changes. New or changing moles, skin discoloration, or unusual skin growths could be signs of skin cancer. Regularly check your skin for any abnormalities. A rash that doesn't improve with over-the-counter treatments or persists for an extended period may indicate an underlying skin condition or an allergic reaction. Severe or persistent itching without an apparent cause may signal an underlying issue, including allergies, dermatitis, or liver or kidney problems. If you start bruising easily, especially without any apparent trauma or injury, it could be a sign of a blood disorder or vitamin deficiency. Non-healing sores or ulcers on the skin could be a sign of various conditions, including diabetes, infection, or skin cancer. Changes in skin pigmentation, such as darkening or lightening of the skin, can result from various conditions, including hormonal imbalances, skin disorders, or medications. Number 5. Vision changes. Sudden loss of vision, double vision, or any other significant changes in your eyesight should be evaluated by an eye specialist or a healthcare provider. If you suddenly lose vision in one or both eyes, it could be a sign of a retinal detachment, stroke, or other serious conditions. Immediate medical evaluation is crucial. Blurry vision, especially if it occurs suddenly, may be a sign of eye conditions like macular degeneration, cataracts, or diabetic retinopathy. Seeing double can be caused by problems with eye alignment, nerve issues, or underlying health conditions such as diabetes or thyroid disorders. Flashing lights or sudden flashes of light in your peripheral vision can be a symptom of retinal problems like a tear or detachment, and they require urgent attention. Number 4. Cognitive changes. Cognitive changes are an inevitable part of the human experience as we age, and while some degree of cognitive decline is normal, there are certain changes that should never be ignored. These changes may indicate underlying medical conditions or neurological disorders that require prompt attention. Memory loss, confusion, difficulty concentrating, or sudden changes in mental function may be related to neurological conditions, infections, or other medical problems. Struggling with tasks that require problem-solving or decision-making abilities may suggest cognitive decline. This can affect one's ability to manage finances, plan meals, or follow a recipe. Difficulty finding the right words, following or joining conversations, or frequent speech errors may indicate cognitive problems or even aphasia, a language disorder. Becoming frequently disoriented, getting lost in familiar places, or experiencing confusion about the time, date, or location may be signs of dementia or other cognitive disorders. Number 3. Lumps or swelling. The discovery of a new lump or unexplained swelling in any part of your body should be evaluated by a healthcare professional, as it could be a sign of various conditions, including cancer. Breast lumps. Any new lump or thickening in the breast or underarm area should be promptly evaluated. While many breast lumps are benign, some can be a sign of breast cancer. If you notice a lump or enlargement in your testicles, it's important to see a doctor. Testicular cancer is most common in young and middle-aged men and can often be cured if caught early. Swollen lymph nodes in the neck can be a sign of infection or other medical conditions. If they persist for more than a couple of weeks, consult a healthcare provider. Number 2. Severe fatigue. If you're experiencing extreme tiredness that doesn't improve with rest and interferes with your daily life, it may indicate an underlying medical issue, such as anemia, thyroid problems, or chronic fatigue syndrome. Number 1. Breast changes. Any changes in the breasts, such as lumps, nipple discharge, or skin changes, should be evaluated by a healthcare provider, as they could indicate breast cancer or other conditions. If you discover a new lump or mass in your breast or armpit, it's crucial to have it evaluated. While many breast lumps are benign, some can be cancerous. Any unexplained changes in the size or shape of one breast or both should be investigated. Persistent breast pain or discomfort that doesn't go away with your menstrual cycle, or that is not related to an injury, should be examined. Watch for any unusual skin changes on your breast, such as redness, dimpling, skin resembling an orange peel, or puckering. These changes can be indicative of an underlying issue. If you have a family history of breast cancer, it's essential to be vigilant about any breast changes and consider genetic counseling or screening. That's the end of today's video. We hope you found this video helpful. Let us know your thoughts in the comment section below, and don't forget to subscribe to this channel before you go.